In the world of medicine, we often face complex ethical dilemmas that challenge our principles and decision-making processes. One of the most challenging is balancing the privacy of individual patients with the health of the public. This issue becomes even more complex in the digital age, where information can be easily shared and accessed. This delicate balance is crucial to uphold trust in healthcare while protecting communities from preventable harm. Trust between a patient and their healthcare provider is the cornerstone of effective medical care. Protecting patient information is paramount. It involves not only securing physical records, but also ensuring digital data is safeguarded against breaches. It ensures individuals feel safe seeking medical care without fear of stigma or discrimination. When patients trust that their information is secure, they are more likely to be open and honest with their healthcare providers. However, in an interconnected world, some health information needs to be shared to protect others. This is especially true in cases of infectious diseases where timely information can prevent outbreaks. This is where the conflict arises. The need to share information for public safety can clash with the need to protect individual privacy. Imagine a scenario where a highly contagious disease emerges. The rapid spread of such a disease could have devastating consequences if not managed properly. Doctors may need to alert public health officials about infected individuals to prevent a widespread outbreak. This requires swift action and often involves sharing sensitive health information. While this action could save lives, it might require disclosing private health information. The ethical dilemma here is whether the potential benefits to public health outweigh the risks to individual privacy. Finding the right balance between these competing interests is never easy. It involves weighing the immediate needs of public health against the long-term trust in the healthcare system. It requires careful consideration of ethical principles, legal frameworks, and the potential consequences for all involved. Healthcare professionals must navigate these waters with sensitivity and a deep understanding of both medical ethics and public health imperatives. The tension between patient privacy and public health has surfaced throughout history. This ongoing struggle has shaped the way societies respond to health crises, influencing policies and public perceptions alike. The HIV/AIDS epidemic brought this dilemma to the forefront. During the 1980s, the rapid spread of HIV/AIDS created a sense of urgency among public health officials who were desperate to contain the virus and prevent further infections. Public health officials needed to track the spread of the virus to implement effective prevention and treatment programs. This required extensive contact tracing and data collection, which were essential for understanding the virus's transmission patterns. However, this clashed with the privacy of individuals diagnosed with HIV, who faced immense stigma and discrimination. Many feared that their personal information could be used against them, leading to social ostracization and even job loss. More recently, the COVID-19 pandemic highlighted the complexities of this issue on a global scale. The rapid spread of the virus necessitated swift and decisive action from governments and health organizations worldwide. Contact tracing became a vital tool for controlling the virus's spread. Digital technologies enabled more efficient tracking, but also introduced new challenges related to data privacy and security. Yet it also raised concerns about government surveillance and potential misuse of personal data. People worried that the information collected could be used for purposes beyond public health, infringing on their civil liberties. These examples demonstrate that there are no easy answers when it comes to balancing individual rights with collective well-being. The debate continues as societies strive to find the right balance between protecting public health and respecting personal privacy. Each situation requires a nuanced approach that considers the specific context and potential harms. Policymakers must weigh the benefits of public health measures against the risks to individual freedoms, ensuring that the solutions are both effective and just. Navigating these complex ethical dilemmas requires a robust framework for decision-making, one that can adapt to the ever-evolving landscape of healthcare. 4 key ethical principles provide guidance: autonomy, beneficence, justice, and non-maleficence. These principles serve as the cornerstone of ethical decision-making in healthcare. Autonomy. This principle emphasizes an individual's right to make informed decisions about their own health information and treatment options. Patients should have control over who accesses their data and how it is used. This empowers them to take an active role in their healthcare journey. Beneficence. This principle highlights the responsibility of healthcare providers to act in the best interests of their patients. It goes beyond merely avoiding harm. This includes protecting them from harm and promoting their well-being. Healthcare providers must always strive to improve patient outcomes. Justice. This principle focuses on fairness and equity in healthcare. It ensures that all individuals receive the care they need, regardless of their background or circumstances. It stresses the importance of distributing benefits and burdens fairly, ensuring that everyone has access to essential health services. This is crucial for maintaining public trust in the healthcare system. Non-maleficence. This principle emphasizes the importance of avoiding harm. It is a fundamental aspect of medical ethics. Healthcare providers must weigh the potential risks and benefits of their actions, ensuring that they do not cause unnecessary harm to patients or the public. This careful consideration is vital for maintaining the integrity of healthcare practices. The tension between patient privacy and public health has far-reaching implications. For individuals, breaches of privacy can lead to stigma, discrimination, and erosion of trust in the healthcare system. Patients may be hesitant to seek care or disclose sensitive information, hindering their own health outcomes. Healthcare systems are also impacted. Balancing privacy with public health reporting requirements can strain resources. Additionally, concerns about data breaches and public trust can complicate efforts to implement new technologies and data sharing initiatives. On a societal level, failure to effectively manage infectious diseases can have devastating consequences. Outbreaks can lead to widespread illness, economic disruption, and social unrest. Finding the right balance is crucial for maintaining a healthy and functioning society. Finding solutions that effectively balance patient privacy with public health needs is an ongoing challenge. While there is no one-size-fits-all approach, several strategies can help mitigate risks and promote trust. Robust data protection laws are essential. These laws should clearly define what constitutes sensitive health information, establish rules for data collection and use, and provide mechanisms for accountability and enforcement. Strong legal frameworks provide a foundation for responsible data handling and protect individuals from misuse of their information. Section 6. The power of data. Anonymization and aggregation. Technological advancements offer tools for protecting privacy while still harnessing the power of data for public health purposes. Anonymization techniques can remove identifying information from datasets, making it difficult to link data back to specific individuals. Aggregation involves combining data from multiple sources to identify trends and patterns without revealing individual identities. These methods allow researchers and public health officials to analyze health data and develop effective interventions without compromising individual privacy. Section 7. Building trust, collaborative frameworks and transparency. Building trust between individuals, healthcare providers, and public health authorities is paramount. Establishing collaborative frameworks that involve stakeholders in decision-making processes can foster a sense of shared responsibility and increase transparency. Open communication about data collection practices, the rationale behind public health interventions, and the safeguards in place to protect privacy can help build public trust and encourage individuals to participate in public health initiatives. Section 8. Future challenges. Navigating emerging technologies. As technology continues to advance, new ethical dilemmas will undoubtedly arise. The increasing use of artificial intelligence, big data analytics, and digital health technologies presents both opportunities and challenges for balancing patient privacy with public health. It will be essential to proactively address these challenges by developing ethical guidelines, fostering public dialogue, and ensuring that technological advancements are implemented in a way that respects individual rights while promoting public health. Section 9. A shared responsibility protecting both privacy and health. Ultimately, finding the right balance between patient privacy and public health is a shared responsibility. It requires collaboration, open communication, and a commitment to ethical principles. By working together, we can create a healthcare system that respects individual autonomy, protects patient privacy, and safeguards the health of our communities. Finding this balance is not just an ethical imperative, but a fundamental requirement for a healthy and thriving society.